Bordering Guatemala, Chiapas is one of the southernmost states in Mexico. It is also among the poorest. In February 2008, 3 representatives of Partners for Health in Latin America traveled to Chiapas, where they were met by Dr. Jonathan and Maggie Salgado.
I have lived in Chiapas for a little more than 10 years. We started initiatives in Latin America. That is a very recent thing. It was an idea that developed about 2.5 years ago after working very closely to the governor of the state of Chiapas. We worked with him for 6 years during his administration. I was one of his advisors, and our main concern was to help him promote and bring agencies and persons to help in economic development, social development, human development in general.
The Salgados had arranged for meetings with medical school faculty and President Estrada of the University of Chiapas, or UNACH. Dr. Estrada is a medical doctor and was formerly the Minister of Health for the state of Chiapas. The government has identified 100 municipalities in Mexico as the poorest in the nation, 17 of which are located in the mountains of Chiapas. Each of these municipalities are surrounded by 6 or 7 rural villages. Various universities in the state have taken on the task of helping these communities to develop in a positive direction, hoping to lift them out of their poverty.
Of the 17, the National University decided to take 7 of those to help them develop in the next few years. And those 7 communities are the ones that we have visited. We have seen the needs, we have seen the poverty, and especially the great need there is there for health care. We have all the support of the university, the School of Medicine, the director of the School of Medicine, his staff. There are other agencies within the university supporting 100% our idea of helping those communities. They are not only friendly, they are open and very supportive of what we're planning to do.
The university has put together a 3-pronged strategy to apply resources from the Mexican government, NGOs, and the university. Partners for Health wants to be a part of this effort by collaborating with the university to generate a Chiapas model for mobile health care delivery, telemedicine, and advanced technologies. After an initial orientation session, the team traveled by van to one of the 7 target municipalities, called Ocotepec. The center of the town is surprisingly clean and modern looking. The first stop was in the mayor's office to pay respects. Just a week before our visit, President Estrada and several medical school faculty were also in the mayor's office, where they signed an initial working agreement to help with Ocotepec's development. Back in the vans, the team traveled a few kilometers up the dirt road to the village of Santo Domingo.
In most of these poor communities where there is very little medical care, medical attention, what the government has done in the past is try to establish clinics, very small clinics. Some of them are not even operating. In others, they have had the concept of mobile units. And what that means is a car that goes and provides a little bit of medicine and a little bit of orientation and maybe diagnosis, and then they leave, you know. There is no follow-up, there are no possibilities for real medical treatments. So our dream is to to start one mobile clinic to move around some of these poorer areas, a very well-equipped mobile clinic, and not only very well equipped with the latest technology and the possibilities of providing medical supplies, but also with people. And that is where we see that our connection with the university is a great resource, because medical students can be in charge of some of those projects. Even professors from the university and the School of Medicine who are highly interested in what we're presenting will be the ones who provide the know-how and the right approach and the contact with local peoples.
They are around 40 families with 6 or 7 members each.
Yeah.
So 250 around.
The needs of the people are great, as you have seen. There is a lot of poverty.
Another of the municipalities identified by the university is Zinacantan. The team evaluated this municipality also and found similar issues and problems with health care. The indigenous women here weave beautiful cloth on handmade looms, while the men work in greenhouses growing flowers for export. When the team stopped to look at some of the material, the shopkeeper invited them into her home behind the shop for a light meal. Tortillas are cooked on an open fire inside the block structure. After a few minutes of making friends around the table, Dr. Rick was able to interview Maria, the matriarch of the house. She told us about the troubles the local women face when delivering a baby. All available help is comprised of local midwives. If there is any complications, such as a breech presentation, they are in serious trouble. Dr. Rick asked if the local residents would take advantage of free health education programs in the evenings, if they were made available. Maria said that the people would love that. Maria also told us that they get all their water directly from the local river.
If they had a filter inside their house?
After we explained the concept of a simple and inexpensive water filtration system that they might build themselves or possibly develop into a cottage industry, Maria was positive. Maria then told us how she used to work very hard, but now cannot do much because she has been sick. She has had problems with her stomach and her eyes. She has pain in her lower abdomen and burning and itching sensations on her legs. She went to see the doctor, and he told her that he thought it was cancer. He diagnosed it after an ultrasound and urine test. Maria has also had a hysterectomy, where they removed a tumor, after which she has not felt any better. Maria's story might just have a happy ending. The day after we left Zinacantan, Maggie Salgado reported to us that she had located a gynecologist in Tuxtla who had agreed to take on Maria as a patient without charge. However, we came away with the strong impression that this is just one of many such stories to be found among the mountain villages of Chiapas.
And then I like the idea that is emphasized in the name of the organization, Partners for Health. Partners meaning you and I working together, meaning resources from both countries, meaning the know-how from both countries. And as a result, everything will be stronger, you know. People here will be very much involved, and what they lack sometimes is the funding. People here will be very much involved. What they lack sometimes is the know-how because of lack of opportunities. If we are successful with the mobile clinic in Chiapas, I am sure this can be a great model for other areas in Mexico, in Latin America, and in other countries where there is a big need for healthcare. It would be wonderful if people in Mexico eventually, and this could be part of our long-range objectives, you know, would be the ones who 100% support a project like a mobile clinic and keep the staff and the medicines and the equipment without the assistance of international agencies, and then being able to provide the know-how and the assistance from Mexico to other poor areas in the world.